Good afternoon, ladies and gentlemen. I'm Tej Chad and these are my colleagues.
Neil Tolpalaker.
Adila Mazammil.
Today we'll be introducing the ENJOY approach, enhancing the journey of obstructive sleep apnea or OSA for the youth.
Many kids with OSA get prescribed a CPAP, which stands for continuous positive airway pressure. Although the CPAP is considered to be the golden standard, many kids discard it because they find it weird and uncool. We aim to solve that healthcare challenge. But before we get to that, we hope to educate you more on this topic. To start your educational journey, my colleague, Tej.
Thank you, Neil. Starting off, let's talk about circadian mechanisms, which are directly correlated to obstructive sleep apnea or OSA. Circadian mechanisms are a 24-hour biological cycle that allows us humans to have a sleep-wake cycle. Circadian mechanisms are regulated by the SCN suprachiasmatic nucleus, which is located in the most anterior part of the hypothalamus. The hypothalamus is responsible for keeping the body under homeostasis by managing hormones and regulating the autonomic nervous system. The SCN is often referred to as the master clock of the body and is influenced by light. For example, during daytime and night, it signals the body to either wake up or fall asleep. On top of that, it's also responsible for melatonin secretion, a hormone that is released during nighttime to induce sleep. This cycle of melatonin secretion and regulation by the SCN allows us humans to have a consistent and healthy sleep-wake cycle. However, irregular circadian rhythms can cause cardiac, neurodegenerative, psychiatric, and sleep disorders ranging from dementia to myocardial infarction to schizophrenia. Not only is this concerning, 1 out of 3 Americans are already at risk for developing these irregular circadian rhythms and accompanying complications with it. Now, by passing it on to Neil, who will give an overview of OSA.
Thank you, Tej. OSA, or obstructive sleep apnea, is a sleeping disorder. It occurs when the soft palate slides back in someone's throat while they sleep and obstructs their airway. This can affect the rest of their day, as they usually suffer daytime fatigue and can also suffer major physical, mental, and professional challenges. The first cause of OSA is gender. Men are 2 to 3 times more likely to have OSA, since men are more likely to deposit fat around the neck area. This brings you to the next cause, obesity. When someone is obese, they have more fat around their neck. When they're sleeping, this fat pushes in onto their airway and narrows it. Because of this, they get less oxygen through their body, and it results in OSA. Upper airway deformities like micrognathia also play a part. Micrognathia, or having a small jaw, can result in the airway being cluttered, and because of the airway being cluttered, less oxygen enters the body. Around 23.5 million adults are undiagnosed with OSA, but when someone does get diagnosed with OSA, it's rare that they get cured. The 2 most common treatments for OSA are CPAP machines and oral appliances. CPAPs work by pushing pressurized air down the patient's throat and helping keeping the airway open while they sleep. If this doesn't work, a physician may prescribe an oral appliance. An oral appliance works by pulling the lower jaw out and creating more space around the airway. If none of these work, a surgery may be needed. The most common of these surgeries being a tonsillectomy. In a tonsillectomy, a surgeon may remove the tonsils and adenoids to create more space around the airway. This is more common with children and acts as a more permanent solution for them. Now, onto OSA diagnosis and compliance. To be diagnosed with OSA, a physician has to perform a polysomnography, or more commonly known as a PSG. A PSG is a sleep study in which the physician monitors brain waves, heart rate, and oxygen levels to diagnose sleeping conditions such as OSA. However, once someone is diagnosed with OSA, it's rare that they comply with CPAP treatment, with only 30 to 60% of people actually complying with it. Now to talk about cardiac arrhythmias, my colleague Adila.
Thank you, Neil, for informing us about the connection between obstructive sleep apnea and its compliance. OSA alone is severe, yet it is a high risk for cardiac complications that leave patients' lives at risk. I'll start by discussing the causes of cardiac arrhythmias. When electrical signals are synchronized, cardiac arrhythmias occur. Bradycardia is characterized by a resting heartbeat that is slower than 60 beats per minute. Tachycardia, commonly known as arrhythmia-induced cardiomyopathy, is a kind of dilated cardiomyopathy. It is characterized by a fast or irregular ventricular rate-related left ventricle systolic dysfunction. Any method of high blood pressure has the potential to cause patients ventricular arrhythmias with a history of ventricular irregular beats. On the other hand, high blood pressure can cause patients for it to disappear. Now for how to detect a cardiac arrhythmia. The most efficient way to detect a cardiac arrhythmia is through an electrocardiogram, which measures the electrical activity of the heart. Electrodes that can detect the electrical activity of the heart are attached to the chest and occasionally your heart, your arms, or legs. The most accurate method for identifying an arrhythmia is through an electrocardiogram, which measures the electrical activity of your heart. Electrodes that can detect the electrical activity of the heart are attached to the chest and occasionally your arms or legs during an EKG. Now to inform you of a few common therapies that can help you treat arrhythmias. With the aid of pacemakers, your heart can beat normally and rhythmically. Pacemakers emit electrical shocks, assisting your heart's chambers to beat in unison so that your blood can pump blood to your body efficiently. Secondly, a small battery-operated device called an implanted cardioverter defibrillator is inserted into the chest to find and treat arrhythmia. A shock is administered by the ICD to stop cardiac rhythm that is too rapid. Thirdly, automated external defibrillator, or AEDs, are frequently positioned in public places. It is a safe and easy-to-use device that uses a therapeutic electric shock to treat the heart in sudden cardiac arrest victims. Finally, cardiac ablation, which employs cold or heat energy that produces microscopic scars in the heart and to restore a typical heartbeat. It is one of the most popular surgical methods for treating arrhythmias. Now I'd like to pass it on to my colleague Tej.
Thank you, Adila. Now let's discuss OSA and circadian mechanisms, because they're positively correlated. As Neil mentioned, a several percentage of OSA patients are undiagnosed. Because of this, they are at high risk of developing an irregular circadian rhythm. In fact, 39 to 55% of OSA patients have an irregular sleep-wake cycle. Patients like these have severe symptoms like grogginess and tiredness during daytime when normal humans are most awake and active. On top of that, having a disrupted sleep schedule is often an effective biomarker and sign in most OSA cases. Luckily, CPAP usage has shown to be highly effective in realigning the sleep-wake cycle in OSA patients. Now, I'd like to pass it on to Adila, who will be discussing cardiac arrhythmias and circadian mechanisms.
Thank you, Tej. And now I will briefly discuss circadian mechanisms in cardiac arrhythmia. Non-REM sleep is broken down into three primary substages. The patterns of physiology and behavior are known as circadian rhythms that control the sleep-wake cycle. Due to the body relaxing and the blood needing to circulate around the body quickly, your blood pressure and heart rate will drop throughout this cycle. But during the day, it will increase depending on the activity you engage in. The sinus node continuously produces electrical impulses which establish a typical heart pace and rhythm. Regarding the atrioventricular node, it has atria and ventricles structural systems that are linked together, but when the atria isn't present, it acts as a pacemaker. Ventricular fibrillation is a condition in which the two heart's lower chambers aren't able to function properly and can't circulate blood as quick. That is when the blood pressure drops. I'd like to now pass it on to my colleague Neil, who will discuss OSA in the youth.
Thanks, Adila. OSA in the youth can cause kids to suffer mental and physical problems. To understand this, we have to understand the risk factors of OSA in the youth. The first risk factor is Down syndrome. Many kids with Down syndrome have smaller chins, which can lead to more cluttering around the airway. This is the same for craniofacial disorders like cleft lip. But the most important risk factor of OSA in the youth for kids is having enlarged tonsils. Having enlarged tonsils can lead to more cluttering around the airway, and this leads to less oxygen during sleep. In this case, a tonsillectomy may be needed to remove the tonsils. Now I'd like to pass it on to Tej to talk about our solution.
Thank you, Neil. Now let's discuss our solution. Our solution is broken down into two parts: prevention of OSA and compliance of OSA treatment among children. It's essential to push physicians to assess family history early on in regards to OSA to reduce chances of any patient developing OSA. Equally, it's important to increase CPAP treatment among children. CPAP treatment is usually recommended to children OSA patients when they have moderate to high OSA, and when other treatments such as removing the tonsils, adenoids, and medications don't work. Since CPAP treatment is usually the last treatment option for many child OSA patients, not many healthcare providers or physicians have a solid plan in place to make sure that these children are using the CPAP machine as much as they should be. In fact, more than 50% of child OSA patients who had to use CPAP machines didn't use it long term. Nevertheless, my group and I created the ENJOY approach to solve this long-standing issue by using the laws of psychology. We know that children tend to feel more attached to new objects when they are more secure and confident with that object. That's why we want to use the ENJOY approach and allow children to be able to customize the CPAP machine the way they want to. So that way, not only do they use the CPAP at higher rates, but they'll also feel more confident and secure.
My group and I have created a 3-step method for physicians to employ the ENJOY approach. Our first step is to make sure both the parent and the child are comfortable with the CPAP. If not, we refer to step 2, in which the child is allowed to decorate the CPAP under the supervision of a medical professional. Once the medical professional has made sure the CPAP is functional, the CPAP will then be returned to the child for them to use. Thank you for listening to us, and hopefully together we can enhance the journey of OSA for the youth.